Well, good morning and welcome to Health Talk here on AM 1270 and 96.5 FM KXBX. And yes, Bill, they're new headphones for the studio.
Wow.
So, go ahead and try them on. And
good morning, Lakeport.
Welcome to the show. And, boy, I guess, you were telling me before the show you braved the crowds and the mayhem of the Super Bowl experience yesterday.
Yes, I got together with another couple, and Dan and I went down to grab the ferry in Sausalito, and it lets you out right at the experience.
Yeah.
And, of course, you're frisked, and before you get on the boat, and you're frisked when you get off the boat, and you're frisked when you go into the experience, and cops with machine guns all around everything. I mean, it reminds you of being in Europe or Mexico. The militia and the SFPD are every place. And it really wasn't that crowded. It was about 50-some degrees and cool. The experience, of course, just to go down and you go through the studios. ESPN is there, the NFL network is there, CBS is there.
Oh, everybody's there.
So in every venue, you see them interviewing somebody that's associated with the Super Bowl, and then the NFL experience, which is at Moscone Center. That was $35 a piece if you went in there, and we kind of got our fill at the Super Bowl venue just as you get off the ferry there. So, and the Barcadero, and of course it's just always good to be in the city and get a little different taste.
Sure.
In fact, we were driving back, and my friend is driving, say, where did all this traffic come from? Because we kind of felt like it was a weekend, you know.
Sure, yeah.
We were coming back from the ball game, and I said, this is Tuesday. This is commute traffic.
Yeah,
you know?
I forgot.
But
so didn't you had said that it wasn't that crowded, but do you think that maybe that's just because it was? Did you stay the whole day, or were you there at night?
No, we got there about 1 o'clock.
Oh, okay. So
and then we left about 4. And there was a big people at the ferry waiting to come over from Sausalito when, because there's all kinds of nighttime concerts and all kinds of entertainment venues there.
Entertainment's kind of always been at night.
A lot of the things with the Super Bowl part was it was young people trying to excel at little venues, who could throw the ball the farthest, who could pedal the bike the fastest. I figured that I wasn't going to win any of those.
Oh, why even bother, right?
We had a delicious hot dog from a place, and I went up to the guy and asked him. It was a really crunchy type hot dog, and I says, where are you located? And he says, North Star in Tahoe.
What?
Said, well, I guess I won't be having one of these again.
Did they have a lot of food vendors? I mean,
there weren't a lot of food vendors.
Well,
it wasn't.
You know why? It's because the NFL's got such a tight grip on their brand.
The local street vendors that are normally at ball games and things weren't. I'm sure at Santa Clara, maybe around Levi Stadium, they had a bunch, but and then of course in San Francisco. None of the regular street vendors were allowed to be there. These were all people.
Really.
Yeah, it really is. Yeah. But it was fun, and was glad that we don't have a Super Bowl 50 coming to. What is that?
Oh, this is a Pure Leaf iced tea. No, this is my beer right here. I'm opening it. You're talking Super Bowl, might as well get the party started early.
Well, Paul's trying to go on a healthy kick here, and he kind of shocked me.
Sweet Pure Leaf iced tea.
It's good for you.
Yeah.
But down there, if you wanted a beer, it was like $11 or $12, and then I don't even know if you could get mixed drinks. I know there was a Sonoma wine venue there that had all the Sonoma wines.
Sure.
Of course, I was purely looking for a health studio, somebody that we could feel better about. Ended up in a restaurant having a martini, but.
Well, when you go to the city, you got to have a martini, right? I mean, that's just kind of San Francisco lore.
Well, we ended up in Sausalito. We were freezing to death.
Yeah.
And everybody else was smart enough to take coats and protect themselves. And everybody, we're going to talk a little bit about colds and what's really going around. And then we got into to Sausalito and found a place called Patillo's, I think, to have dinner, which was excellent, and we were home by 8 o'clock.
See, and I've been wanting to. I would like to go down there too. I'm not going to be able to with my work schedule, and tomorrow I got to go. I have a doctor's appointment tomorrow for a consultation on my colonoscopy, which I am getting soon with a doctor in Ukiah, and I forget his name, but
that's who I thought you would.
Yeah, originally they tried to send me to Santa Rosa. And I never heard anything, so I called, and they said, "Oh yeah, by the way, we don't accept covered California Blue Shield insurance." Well, great, thanks for telling me about that. Now that a week has gone by, and I could have, looked elsewhere. So then I called back to the clinic, and they found this place in Ukiah, and so I'm set to go in tomorrow. He's
very good. He was Dr. Hansen's partner. He actually started the gastroenterology business in Humboldt County, or in what is Ukiah? Is that Humboldt County?
It's
Mendocino County. Yeah. And Matosian's his name.
Is it? Okay.
Henry Matosian. I assume that's where they're sending you, and he's excellent.
Good.
And it's about time that you followed up on something like that and got it done. But.
Yeah, well, and then I got the sleep study at the end of towards the end of the 18th. I got to go down to St. Helena for that consultation. So, everything's just kind of falling into place right here the next month.
You'll be a new man by March.
Well, I figure I was joking with my wife. I said, if they find anything in my colonoscopy, they can give me a carbon colon, and then replace it with something carbon or something like that. And then when I go to the sleep study, they'll give me the CPAP machine, and I could just attach it to myself and wear it constantly. I'd be like halfway to Darth Vader.
Yeah, you would be.
More machine than man anymore,
Well, one thing is we got to get you healthy, and you've with this health insurance thing is one of the things that a lot of people have been holding off on. By the way, you're listening to Health Talk. It's 263-5252 if you want to call in and ask any questions. This is Paul and Bill talking to you about your health and our health, and anything we can do to improve it. And it's interesting, the Iowa caucuses. I don't know if you paid any attention to that, Paul.
I did, yeah. I was quite surprised.
Mr. Trump didn't make...
well, he blames himself for not doing the debate now,
But some of the Republican candidates came out quite strong, and, of course, Hillary and Bernie have had a virtual tie. There were 6 times when they had to flip a coin because they were tied in these precincts.
Oh, really? Like actually tied, huh?
Yeah, and 6 times Hillary won. That's truth.
Is that really? Yeah. That's amazing.
So, but anyway, they're on to another campaign, and this whole year we're going to be talking a lot about health care and what may or may not be part of a new regime, hopefully to get better services. I think he was something like 8 million people short of what he wanted for to be signed up for Obama-Care by now. So, and I'm sure it's helping some people, and I hope it is, and I hope it's affordable for you. Our crisis right now appears to be these colds that are going around and flu. If you haven't got your flu shot, get it as soon as you can. We have about 10 shots left, and they are good for this year and part of, or last year and part of this year. They expire. We can't give them beyond the 16th of, or the end of March. They expire the 1st of April. So if you haven't done that, you should. And then we're going to talk about what some of the best remedies are for colds. If you're dealing with a cold, and I know, Paul, when I grew up, my mother would give you a hot chicken soup, chicken noodle soup, or hot tomato soup, and you might hope that that's a remedy for colds that will help you feel better for the week or the 2 it takes for the viral infection to subside. And if you paid attention to my last sentence, viral is the key. This isn't a bacteria. Colds are viruses, and that's why they don't respond to antibiotics unless there is something that eventually leads into a bacterial infection. So you wonder what the home remedies, what's good and what isn't, and if chicken noodle soup really helps. Well, there's evidence that says that it does help ease your discomfort, and it's the best known regular, chicken soup or chicken vegetable soup inhibited the movement of white blood cells that trigger cold symptoms such as a stuffy nose. Should you try it? I would. I get some comfort from it, even if it's not. If it's not something that I normally would be taking for a cold. If it's a cold, wet day like we've had so many of, I'll go next door and buy a can of chicken noodle soup and eat it for lunch in the pharmacy. When your mucous membranes are inflamed like they are so much, your nose gets crusty and dry, and that soup helps loosen the mucus that can expel it and get it out of there. And I'm trying to tell a patient of ours that, and she's quite a lady and doesn't want to do this, but if you would take Mucinex or guaifenesin, which Mucinex is, and drink several glasses of water with it, and you have that rattling in that cough that just kind of rattles down there, that's an expectorant, and it will loosen all that phlegm and mucus loose, and then when you cough, you'll cough it out of there. Now, being a guy, we don't think too much about it. We just take our handkerchief out, I hope, and do you, Paul, or do you just go to a corner?
I don't know. Depends on where I'm at.
Yeah.
If I'm on the street by myself, you better watch out.
Well, I think a few of your friends were in San Francisco yesterday.
Oh, yeah.
Because, but anyway, you expel it, you get rid of it. Women don't want to do that so much, and they have much greater scope of manners than a lot of the men do, especially in a rural area like we're in. And so
what are you trying to say?
You never. Well, anyway,
we have no manners.
We either have those big blue or red handkerchiefs, or we skip that part of it. But no, on to the next thing. What about a hot drink? I mean, I've had I've thought about a hot brandy when I'm not when I was skiing in Switzerland. This was 50 years ago. They actually had the St. Bernard dogs with brandy or rum, and
that's not a myth, huh?
And that's not a myth. I don't know; they probably don't anymore. But back when I was a kid, they did. And I actually was skiing in Europe, and when I was I just graduated from college, and I had learned to ski in Austria, where you skied with an instructor and everything. And never had skied before. I lived in Iowa. There were no mountains in Iowa. And so I learned to ski in Austria. I go to Switzerland, and we go up to the Matterhorn. And the guide that takes us up to this railroad called the Gunnergraten, we go to the Matterhorn, and he lets us all out. It's a blizzard up there.
Oh, boy.
And I know how to ski about as much as, I probably less than you do, Paul. So all I could do was stems. I couldn't do parallel skiing. And so everybody leaves. I'm up there by myself. Everybody leaves the steepest part of the mountain, and they go straight down. I have to traverse. Well, I'm traversing around the side of this mountain up at the top, and it had melted, and the ice had formed right on this ledge. I caught the tip of my ski on this ledge, and I fell about 50 feet and pulled my groin, and I couldn't get up.
Wow.
See, my history of
injuries.
injuries.
You could probably write a book about it. I'm sure you could.
So I'm laying under the ledge of this mountain. The sun had come out then, and I could hear everybody going over the top of me, but nobody knew I was down there. So finally a ski patrol came and picked me up in a sled and took me down to the bottom of the hill. The only problem was I was in Italy now and not in Switzerland anymore.
Oh, no.
So they had to bring a helicopter in and get me over. It just had to go over the mountain, but if I'd have driven, it would have taken me a day.
Oh, my goodness.
So that was the end of my skiing career in Switzerland.
Wow.
So I sat in my room and drank the hot brandy, and it seemed like it helped. But if you turn to hot tea when your throat is sore, like you're drinking cold tea, but hot tea, there is a study that was done in England where they gave 30 cold sufferers drinks that were either hot or tepid, meaning just on the verge of being warm. Those who sipped the hot beverages reported more relief from a runny nose and coughing and chills and sneezing. And I don't know if you've ever had hot tea when you're really cold, but it really opens up the respiratory tract, really opens up the nasal tract, and you feel a lot better. And sometimes the sneezing goes away, the running nose goes away. Those results were probably due to a placebo effect, but hot drinks do appear to have benefits for sore throats, whether or not it's the active ingredient in it or if you just drank hot water. The taste promotes salivation and secretions that lubricate and soothe your throat. So any hot, tasty drink, soup, or hot meal is likely to be effective. So think about that. Sometimes I'll just have a chicken or a beef broth. The broth. And I enjoy the drink. I enjoy the flavor, and it does help a sore throat. So try it, sure. Maybe with a little bit of honey. Hot tea can be particularly soothing for a sore throat. The honey kind of helps as a cough suppressant. They don't recommend honey as being a first choice, but maybe. Then you talk about just taking honey itself for a cough. There was a 2014 review that looked at 3 studies that compared honey with one or more of the following over-the-counter cough drugs: dextromethorphan, which is the cough suppressant that's in Robitussin; diphenhydramine, which is an antihistamine; and no treatment, and a placebo. So the conclusion was honey was more effective at relieving a cough than no treatment and a placebo, and it might be slightly better than Benadryl or diphenhydramine. But dextromethorphan was the best. And try it, maybe. Coughing helps you get rid of excess mucus, so you don't want to stop it completely. And that's why we tell people to buy Robitussin DM. It's the expectorant and a cough suppressant at the same time. So you have 2 ingredients in there that are kind of working against each other. One is loosening it all up, and the other is suppressing the cough. If you buy just guaifenesin or just Mucinex, that's the expectorant properties, and you want to cough it out of there. But if you're considering an over-the-counter cough treatment, little evidence that most drugs were effective and that the American Academy of Pediatrics says they don't want young children to do any of this. Actually what I found out better for cough than anything, if you... with a bad back, I've taken hydrocodone or a similar drug that had a codeine property in it, and the codeine really acts as a cough suppressant. Now, most people don't have that, and I don't have it most of the time, but I found it effective. I went back into a drawer that I had of June of 14 that had 3 Vicodin in it, or Norco, and that was enough to stop my cough enough that I could get some sleep. And then I just took a lozenge. There's one of the worst tasting lozenges out there is Fisherman's Friend. I don't know if you've ever tried it, Paul. Comes in a little envelope. And
is it licorice flavored?
No? I don't think it is.
Or clove flavored?
Yeah, it's the licorice ones used to be Dr. Smith's, the Smith Brothers cough drops.
Okay.
I loved those things.
Those were pretty good. What about clove? My dad used to have, he had clove gum. That's what he had. Well,
that was back with the blackjack gum, which was licorice.
You're
coming back into my era now. Pretty soon we'll have bazooka bubble gum, but those things, anything that keeps a lubricant, keeps your throat lubricated, is going to help stop a cough. The menthol ones that they have out now, the mentholyptus, those kind of drops are really helpful. I just find out that I have to take one after the other after the other, and pretty soon the amount of sugar you're getting is substantial. So you buy the ones that are sugar-free, still have the amount of cough suppressant in them, eucalyptus in them that the others do, and fairly effective. When you have that cough that people are having right now, which is just unforgiving, and it makes you so you can't sleep. The minute you put your head down on the pillow, you start coughing. If you elevate your head a little bit, that helps. If you have a vaporizer or a humidifier, that helps. If you have a rescue inhaler, like an albuterol inhaler, like ProAir or Zopanex, that helps. You have to be careful about the steroid inhalers that are on the market now with Spiriva and Brio and all the combinations of different medications together, because on one form of them you can only take one puff a day. Another form that's a combination drug, you can take one puff twice a day. But really be sure with your pharmacist. My problem is the physician, pulmonologist or internist or could be an oncologist, gives them something to help them breathe. And if they tell them how to use it, they forget. And then they're calling me and saying, my wife's out of her inhaler already, and we need another one. Well, you just got it 15 days ago, and it's once a day. Well, they ended up using it more than once a day. Anything that has a anticholinergic in it or a drug, a steroid in it, you have to limit the amount of time that you use it, unless on a daily basis. Using it on a daily basis is the way for it to be the most effective, but you have to limit the frequency of use on those days. So we used to tell people it took 72 hours to get a steroid medication into your lungs where it was the most effective. And then you couldn't use it as a rescue inhaler because it takes a long time to saturate the tissue. They have backed off a little bit, the manufacturers now, because they want you to buy more of it, and they've said, well, you can use it on an as-needed basis. It's just not effective. As you go on, it's more effective after 72 hours. So call your pharmacist or your physician if you have one of those. Our problem with most of the inhalers are people are not using them properly. Most of the new inhalers, you have to actually breathe in instead of, it used to shoot it into the back of your mouth and then you would hold it in there and leave it. Now you have to actually withdraw it out of the container. The capsule that's full of a powder is broken by the mechanism, and then you have to actually suck it in out of the inhaler to make it effective. You have to hold it there as long as you can and let it saturate the tissues and then swallow it. And you can the big thing with steroid inhalers is you need to keep them clean, and you need to also use a mouthwash after using them, because you can get a fungal infection or a type of infection or a really red rash inside your mouth from not using a mouthwash afterwards. So and then keep the inhaler clean. So lots of things that are different that we never used to worry about, even when I was practicing pharmacy in the very beginning, and we have to do now to make it correct. So more reason for you to pay attention when you're dispensed a medication, more reason for you to pay attention when you're in your physician's office and they're telling you what this drug is going to do. We try to tell you what a drug does. Sometimes if we're too thorough, we scare you from wanting to use that medication because the potential for side effects occur. You've heard us talk about risk versus benefit. Yes, this is going to help you. This is the benefit, but there's a chance here that there may be some side effects that you need to work through, and if you don't work through them and they continue to develop or hinder you taking the medication, you need to tell the physician and pharmacist about that. Otherwise, what's going to happen is they're going to assume that drug isn't as effective as it should be, and they'll prescribe you another drug, and not specifically to eliminate the one you're taking now, but to add it to it. So remember last week we were talking about some people taking 2 or 3 or 4 different medications to get their blood pressure down where it should be. The same thing can happen with inhalants. So you need to really learn to communicate. And today you may not be talking to the same physician you talked to a month ago, but it makes no difference. You know, you're the patient, you're paying for that service, or your insurance company is, and they need to listen to you, and you need to be more dominant about your health care, or it will run itself away from you. We're going to take a break, and when we come back, we're going to talk about a little bit of lifestyle changes, which you don't want to hear because you'd rather the pill take care of it for you. Did you know that according to the American Heart Association, heart disease is the leading cause of death among men and women in the United States? Hi, my name is Bill Kearney, pharmacist and owner of NorthLake Medical Pharmacies. The good news about the heart is that a healthy lifestyle can prevent the vast majority from the disease. There are risk factors that you can't change, such as being male, being older, and a family history of heart disease. But other risk factors that you can change. Smoking. Do you know that 30% of all the deaths from heart disease are directly related to smoking? High cholesterol. Limit your fat intake and limit intake of cholesterol. Increase your intake of vegetables and fruits. Exercise routinely and drink 32 to 64 ounces of water daily. When these things are done in combination, they can drastically reduce your chance of developing heart disease. While these procedures are very important for people with risk factors, they're even more important if you've had a heart attack. NorthLake Medical Pharmacy with 2 locations for you, and now free delivery to Lakeport, Nice, Upper Lake, Lucerne, and now Kelseyville, the Rivieras, and Buckingham.
Here's the snap. It's a handoff to Rocky Carr. He breaks a tackle. He's at the 40, the 30, the 20. He could go all the way.
Not so fast, Rocky. Did you remember to register with Selective Service within 30 days of your 18th birthday?
No. Oh, too bad. Rocky Carr is stopped just short of the goal line. What do you make of that, Chet?
Well, Al, the law says that every man must register with Selective Service within 30 days of his 18th birthday. Now, Rocky could have registered online at www.sss.gov or at his local post office. Hey, it's the fundamentals, Al, and Rocky just didn't get it done.
You're right, Chet. That's got to be a big disappointment for a young man who had such a promising future. Let's see that again on instant replay.
Let's not, Al. It's pretty painful to watch.
Deep within the Pest Quest training laboratories.
Stinging insects send over 500,000 people to the hospital every year. I don't like hospitals. Rodents, like mice, contaminate food and transmit disease.
Cockroaches spread 33 kinds of bacteria, 6 parasitic worms, and can trigger asthma. That can't be good.
Pests are anything but child's play. Protect your little scientist by getting the facts at pestworld.org.
A public service message from the National Pest Management Association.
These days, the concept of value matters more than ever. And you'd be hard-pressed to find a better value than high school sports. Extracurricular activities, including sports, make up about 2% of the budget for a typical California high school. In return, participation in sports promotes citizenship and sportsmanship. Sports also instill a sense of community pride and teach lifelong lessons about cooperation and self-discipline. They encourage physical fitness. They produce community leaders. By offering so many benefits to the community for such a small percentage of a school's overall budget, it's easy to see why high school sports are one of the best bargains around. The real cost would come from not having them at all. High school sports, a winning part of a complete education. This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
Okay, we're back.
Well, Paul, I didn't know whether to start with jogging to get you into shape, or talk about changing lifestyles, and I decided they were both about the same thing. So,
But I already can tell it doesn't apply to me, this article. So,
well, yeah. It might. It's
all right. Let's hear it.
Do you want to? It's
Jogging.
Well, I thought I could start with the alcohol part. If you have moderately elevated your systolic blood pressure from
drinking alcohol? Did that help you lose
150
weight?
to 160 for people 60 or
Sign me
older,
up.
or 140. Do you know what your blood pressure is?
I always have had high blood pressure. Like,
I wonder why. Yeah,
it's interesting because they always when they take my blood pressure, they always it's like right on the cusp of it being a little bit, and it's not high. It's like the medium one, but no, that's not right. My blood pressure is usually good. It's my heart rate that's always up.
Yeah,
I have a fast heartbeat.
Well, losing weight, exercising more, cutting back on salt, non-salted.
These are the worst. Cracked pepper.
Yeah,
I've eaten the cracked pepper ones today.
Limiting alcohol to no more than 2 drinks of regular beer, or 10 ounces of wine, or 3 ounces of 80 proof whiskey per day.
3 ounces? What is that, like a half a shot?
No, a jigger is 2 ounces.
Jigger is 2 ounces? Okay, so be like...
a jigger and a half.
Jigger and a half, okay.
Do you qualify, or...?
No. We could get there, baby. I mean, see, the drinking thing doesn't seem too hard for me.
Yeah.
Like this. I didn't have a single drink all weekend, and last night I had one before dinner, and I didn't even finish my second one. So that's pretty easily solved.
Yeah. What about having a cigarette?
Cigarettes, I have not bought a pack since the weekend, but that doesn't mean I haven't smoked. But that's usually my first step. I had 1.5 cigarettes yesterday, so I'm weaning myself away from that as well.
Well, you're going the right direction, but if you you need to continue the healthy habits that you're not doing,
What? Sunflower seeds, the diet and exercise is really what I don't do.
Yeah, and you used to.
Yeah.
Probably not.
I used to diet. I never exercised.
Yes.
I don't know where you get this idea that I love exercise.
You used to be a jock, remember?
I did, but that was different. That was playing organized sports, and and I often think to myself, like, boy, it might be kind of fun to join a softball team, or hey, it might be fun to, I don't know, get into some sort of a team sport.
Did you ever golf or anything?
I've golfed, a couple times in my life, but they've been actually more recent than ever before. In fact, I went golfing when my brother came up over the Halloween area or weekend or something. He was up here and we went golfing, and I would like to get into that more, get into golfing. But you got to have people. Usually, you go with people that also golf. And the people that also golf that I know are really good at golf, and I'm really poor at golf, and they don't want to play with the poor people, that are learning.
Yeah, that's my problem. My wife has proposed me working less days a week, and I said, well, what would I do? And she said, well, take up golf, take up fishing, and nobody wants to, of course, I've got a broken shoulder, broken neck, broken arm, broken leg, I want somebody to teach me, as I was returning from Vietnam 40 years ago or 50 years ago, teach me how to play golf handicap.
Sure, yeah.
And all I want to do is go out and
hit the ball and walk.
And hit, I'd like to just hit the ball, instead of swinging around and throwing my back out of place again and missing the whole thing completely. Yeah. And I've played in a few celebrity tournaments where it's just best ball, and but I got to get back here to medicine, see and how it works. And if you'll notice, a lot of what I'm talking about is not taking more pills. Now, last week when we talked about high blood pressure, we talked about being on more medication to get it down to 120, over 70, and that's a goal that we should have, and how that takes extra medication to do that. And like I said before, we always talk about risk versus benefit analysis, and is it worth the risk of you being healthy to give up those things that cause you to have health problems. Sometimes I watch this food channel, and it has these excess man versus food challenge or whatever.
Yeah, I watch them all the time.
Well, the one I saw the other day was about this heart attack on a plate in Las Vegas.
Okay.
And when you check in, a nurse and a doctor check you in.
What?
And
this is like a theme restaurant, right?
Yeah.
Okay. I think I've seen this on a burger or something.
Yeah. And so you eat whatever the name of the biggest burger is. You eat it. In order to qualify to eat multiple ones, you have to weigh over 300 pounds.
Oh, really?
And then you have to get on the scale and all these people are hugely obese. And they all look like they're going to die of a heart attack in a minute,
Wow.
And they just then they eat one of those sandwiches and they get on the scale and they're still 426 pounds or more, and then they get on the scale and do it again. That's what I don't want you to do, Paul.
Oh, well, I'm never going to go that extreme.
Are you still going to go to Nashville and wherever it is you go and for St. Jude?
Oh, St. Jude. No, I didn't get to go this year. That was they went in middle of last month. So that Memphis is where
Memphis is where I'm going to Nashville.
When I do go to Memphis, though, on those trips, I do eat quite a bit of Southern food, which is
comfort food.
Yeah, comfort food, barbecue, fried chicken.
Yeah,
that kind of thing. It's not the healthiest for you, but it tastes darn good.
Yeah, and you only go once a year.
Yeah.
You never abuse a food thing ever.
Well, I've been trying to eat less. Also, in lately, and I'm especially at dinner time, I'm eating smaller portions. Like last night we had tacos, and usually I'll have 5 or 6 tacos. You know what I mean? Last night I had one. I had one taco last night. Of course, it was filled with all the good stuff, but I just figured that's a good way to kind of try to at least be proactive with the diet thing.
Yeah.
It's just smaller portions.
Yeah, and once you get used to smaller portions, you really don't want. I did Nutrisystems for a long time, and it was they were pre weighed out portions, and that was very effective for me. But as soon as I got off of it, and I go back to the old macaroni and cheese casserole or whatever it was, I've been able to maintain my weight pretty well since my shoulder surgery. But I let it go back up again after I broke my leg and got hurt, and now I'm back down to like 180 pounds. I showed somebody the pictures yesterday of when I was inducted into the Army, 245 pounds, and then after basic, 169 pounds.
Wow.
They actually had to put weight back on me to play football for the military. But anyway, we're talking about health, and we're mixing a lot of other things in with it. And along with this, I want to emphasize how difficult it is for many patients to pay for their medications today, because either of Obama-Care or my health insurance just went up another 20%. My Medi-care F went up the third time in a year. It's almost been 50% in the last year that it's gone up. So it makes no difference if you're on regular insurance or Medicare. You're still paying more and more and more for your medications. And I had a patient come in the other day because he couldn't get strips at our pharmacy, but he could get them at another pharmacy. And they told him that because we were an independent pharmacy and we didn't have multiple stores, meaning more than 3, we were not allowed to dispense the medication to them at the copay that he was getting someplace else. That's not our choice. That choice is by the big entrepreneurs. I just read where Walgreens bought Rite Aid, and now the person that has taken over Walgreens is a European billionaire that was with the Boots company that was part of Walgreens, and his goal is to make it more profitable and more profitable and more profitable, and the way you do that is pay providers less and less and less, and raise the prices for the things on the shelf to a higher retail unless you can get a lower cost of goods. And that's where an independent falls into the hole. And I'm in in a co-op with 1,300 other stores, and we have a lot of pull with our wholesaler, who happens to be Walgreens wholesaler also. So what we're doing is trying to keep the costs down in California as well as in the United States. I had gone to Mike Thompson in October when I was here, or when I was in Washington, D.C., to see if he could help us on some bills. I saw him Friday night at a function, never said a word about being able to help me. So whether or not it isn't evident that that his support has done anything to get my prices lowered or make me more available to a lot of you, or our pharmacies available to a lot of you. But it's an upward slope, and we're trying to do the best we can to do more and more for you. If you're in that category of not being able to afford your pills, you know some of your pills you can split, and not run them through your insurance company. Run them through a Good Neighbor Pharmacy plan that we have, and you need to know which of those pills you can split and which of them you can't, because some of them are time release, and when you cut them in half, they become immediate release. Now, I was trying to explain to somebody last night about the potential toxicity or harm that a narcotic medication could do that was time release, and you cut it in two, and all of that hits at the same time. Plus, frequently an addict will use other medications with it to cause them to get higher, and this is released all at one time, and the other drug is released all at one time, and then they quit breathing. And another question I was asked, well, my son was in rehab, and he got out of rehab, and he fell off the wagon, and he went back and took the same dose of oxycodone and fentanyl that he took before, and he OD'd. And why did that happen? Well, your body gets used to the medication not being in your system anymore. So when that individual started taking the medication in the very beginning, before they went into rehab, they gradually titrated it up to where it was a certain level. And now they've been in a rehab, their blood's completely clean, and then they start out at that same level. Well, that same level that you would build a tolerance up to before now is fatal. And that's why you see these people dying. And the other thing they do is heroin. Heroin is the cheapest narcotic that you can get in the United States today. And you could get it within 15 minutes of sitting here at this studio and by making a phone call and get it in Lake County for $20. Don't try it, but you can. That's how available it is. As we put more and more restrictions on opiates and tell you that you can't get your Norco filled anymore, or you have to cut back the dosage and the federal government is dictating to you, then what we're afraid of is that people will go to another narcotic, and then it becomes really toxic. And you don't know the purity of what you're getting. Most of it comes out of Mexico. So I would advise you, unless you're on the verge of death, don't make that switch. Try to get clean and start tapering off that opiate unless you have a terminal illness. If you have cancer and there's no way that pain is going to go away, and you know your time here is short, I'm all for suppressing that pain medication and suppressing that pain from 1 to 10, and every time we ask you, you said 9 or 10, then you ought to be able to have it and take it the way you're supposed to take it. When you come in and you're 2 weeks early, according to the dosage, we can't do anything for you, because the insurance company and the doctor said this was supposed to last you so many days, and it didn't. So it's important for you to not overdo those things, and be aware of the potential problems it could have. And this isn't always just pain medications. It can be other medications too. It can be anti-inflammatories that are eating your stomach apart. I talked to a person yesterday that said they had trouble sleeping, and the sleeping medication they took wore off in a short amount of time, and so they took 2 aspirin afterwards. If you or I did that, and the individual said, I went right to sleep, this individual had bariatric surgery, and he already has problems with heartburn and esophageal reflux. I'm afraid with 2 5-grain aspirins, which would be 10 grains of aspirin a day at nighttime, is going to eventually erode what gastrointestinal lining that he has in a smaller stomach and a smaller intestine, and eventually have an ulcerated colon or an ulcerated intestine. And that's what you have to watch out for, because we allow a lot of stuff to be taken over the counter. This individual could be taking ibuprofen at the same time, any non-steroidal anti-inflammatory, which will even add to the toxicity of the aspirin. So think about those things. The reason we have things over the counter isn't because they're entirely safe. It's within guidelines at the dosage that they're selling them, they appear to be safe. But if you take multiple doses of those medications, or you take combination medications that have both things in both medications, you're going to develop up an ability or a real risk of affecting your liver or kidney. So, and I saw something the other day about, we talked about this a week or 2 ago, about grapefruit juice and taking statin drugs and what they do. And one report was kind of poo-pooing it, saying it's not important at all. The other report says it's drastic because of the risk that you're taking of that staying in your bloodstream and not being able to be reversible. If we do a blood test every 6 months, what we call a liver panel, and find out that you have elevated enzymes in your liver, we know that you're overdoing the statin or overdoing the ibuprofen, whatever it is, then we can reverse that just by getting you off the medication, and the liver will resume its normal chemical entity that it normally is. So, I don't keep trying to make it more complicated, but you have to know that there's reasons for these things, and lots of times we can fix these reasons and get you back into health without really changing any other course of your life, except with Paul. We're going to have him starting jogging, and you'll be in fine shape, Paul. So.
Okay. Will do.
You probably haven't got your flu shot yet, or did you?
Oh, I got my flu shot a long time ago.
You got it from Sutter,
mm-hmm.
yeah.
No, I got, from Sutter at the health fair.
At the health fair.
Yeah.
Your wife, too? Yeah, everybody did?
Yeah, the whole family.
Well, I don't want people to get the flu if they can help it. If they haven't had, if they're Medi-care age and they haven't got their pneumonia shots, Medi-care pays for them. Come on in. If you want to get started jogging, just add 30 to 60 minutes of weekly jogging, and can add up to substantial health benefits. So check with your doctor. It's okay for you to jog. That's especially important. I ride my bicycle in physical therapy.
I like
that. I did 2 miles today, and I don't have Paul serenading me, so it makes it a little more difficult.
No, but see, if I had somebody serenading me, I might be more inclined to do it.
Yeah.
Like a theme song.
Well, you need to develop a baseline fitness. A baseline. Start with something that's just regular, and work up to being able to walk 150 minutes a week. What's that, 30 minutes, 5 days a week?
Yeah, I could do that.
Yeah. And walking is as good as anything. Dress right. Don't be wearing your tight Levi's and, a sweatshirt that's 2 sizes too small. Purchase a pair of comfortable and supportive walking or jogging shoes. When I was in Hawaii, I looked at the shoes that I was wearing, and I was going to duplicate them and buy them over there. I think I paid $89 for them. They were $169 in Hawaii, so I decided I'd wear the same pair for a while. But, your walking shoes should be light shoes that will be more comfortable to wear, and you'll be producing heat, so you can dress in lighter clothing for jogging than you would for walking. Take it slow. Start by walking. After 5 to 10 minutes, try jogging. You can do this on a treadmill too. You don't have to be outside, and try to avoid injury. That seems to be a key product for me. A healthy.
If you could only market it, Bill, you're a millionaire.
A healthy tip is avoid accidents. So, I don't want to do one of these fitness tracker things because I'd be afraid I'd be looking down at it instead of looking where I was going. But I set goals, and that's part of the purpose in you working on a healthcare program is to set goals and see if you can make it better for you. I have a problem with my cholesterol. My HDL is good. My HDL is bad, and my LDL is good. Most people worry about their LDL, which is the bad cholesterol. My HDL, my good cholesterol, is too low. It needs to be higher. And there aren't very many current medications that will pay any attention to a high or low HDL. So eating more saturated fats and avocados or simple carbs such as sweets and white bread was found to increase HDL by 12.5%. Well, how many people are told to eat less white bread? And here this telling us to eat more. Fish rich in omega oil. Also helpful is eating 2 to 3 servings of fatty, low mercury fish like wild or canned salmon. Have you ever seen this commercial with the guy with the yogurt? And he's looking at this cow and he says, "This is the best yogurt I've ever had in my life." And he's talking to a Holstein cow. "I just want you to know how important this is and how great this is." And the cow's just looking at him. And then all of a sudden, he's an old farmer like I am. He turns around and runs away as fast as he can because he's afraid the cow will be interested in him. But
I have not seen it. No.
Well, it's one of those that, it has to be pretty simple for me to understand. And that one was one that got me. And it's one that was the right kind of food. Well, time is up. I'd like to remind you we're NorthLake Medical Pharmacy with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192. And outside the Bruno Shop Smart, 347 Lakeport Boulevard, give us a call there at 263-1328. And remember, we deliver to Kelseyville, Lakeport, Nice, Lucerne, and Upper Lake. So give us a call, and we'll deliver your prescription for you. Thank you, Paul.
You're welcome, Bill, and we'll see everybody back here again next Wednesday at 10 a.m. for Health Talk right here on AM 1270 and FM 96.5 KXBX. Got a pick for the Super Bowl before we go?
I'm going to have to say that it's going to be Carolina, although I don't want it.
I say go Broncos.
Okay, got it.